good senator, first of all, from Tennessee, Senator Lamar Alexander, for basically shepherding this through and working in a bipartisan way. And it's the most important piece of legislation. Also, to all the colleagues, this is the way legislation should work. It's something that was worked on for a long time and well thought out. Senator Blumenthal from Connecticut, everyone that worked so hard on it. American people are drowning under the weight of the prescription drug epidemic. My state of West Virginia has been hit the hardest. More than 1,000 West Virginians died of drug overdose in 2017. 870 of those deaths involved an opiate. This is a record number of opiate-related deaths, up from 759 opiate-related deaths in 2016, which was a record that year as well. Let's put this in perspective. If those of us who are old enough to remember watching the Vietnam War on television and the outrage, rightfully so, that came of that, the protest, and how we were able to bring that to an end. During that entire Vietnam War period of close to 10 years, 58,200 young Americans' lives were taken. Just last year alone, last year alone, we lost more than 72,000 people to a drug overdose. 72,000 in 1 year. 49,000 of those people were killed by opiates, heroin, and fentanyl in 2017. That's an average of 134 people dying of an opiate overdose every day. It's a silent killer. If we had these types of numbers and we were losing them, they were on television, they're in every neighborhood, they're almost in every family's home one way or another that's affected. The country would rise up in outrage, as they did with the Vietnam War, watching the carnage. That's why I'm glad to support this bill today, because it will take a number of critical steps to help us stop that devastating epidemic, many of which I have pushed for. It would reauthorize critical state grant funding to address the crisis and ensure that this funding is going to the hardest hit states, such as my state of West Virginia. It would put Jesse's Law on statute requiring HHS to develop hospital standards to flag a patient's opiate addiction. It's so simple. You'll go into a hospital to be admitted, and they're going to ask you if you're allergic, what you're allergic to, penicillin, and they mark it all the way through. Jesse's Law is such a common sense piece of legislation that it could have saved this beautiful young lady, and hopefully it'll save thousands of others. While this language was included in the fiscal year 2018 appropriations bill, HHS has not yet acted. This bill will force them to do so. It would also strengthen response by our federal agencies. FDA and NIH will be pushed to encourage the development of non-opioid pain treatments. FDA will also be given the authority to do more work with the CBP to stop the flow of illicit opiates like fentanyl, which has driven up opiate overdose deaths substantially. DEA will be required to consider diversion abuse and overdose deaths when determining their opioid quotas, something that I have been pushing for years. It also would allow states to use federal funding for programs like the Handle with Care program in West Virginia, which helps connect traumatized children with the resources that they need. And it would make it easier for Medicare and Medicaid beneficiaries to access the treatment that they need. These are critical steps. But so much more has to be done. It must be done. I'm particularly disappointed that the package does not include the Jesse Grubbs Legacy Act, which makes common sense changes to the regulations for substance use disorder treatment known as Part 2. We lost Jesse more than 2 years ago for one simple reason. One of her physicians did not know that she was in recovery from an opiate addiction and sent her home from the hospital with 50 oxycodone. This could have been prevented very easily. Well, I'm very pleased that the bill includes Jesse's Law, which was also included in the FY18 appropriations bill, and would help hospitals develop systems to flag patients with opiate addiction. It does not include the Legacy Act, which would solve the larger, more systematic problem that is keeping those in recovery from getting the coordinated care that they need. The Legacy Act is needed because the Part 2 regulations are simply not compatible with the way that we want health care to be delivered in a coordinated manner that takes into account the whole patient and all of their medical needs. Access to a patient's entire medical record, including addiction records, ensures that providers and organizations have all the information necessary for safe, effective, high-quality treatment and care coordination that addresses all of patients' health needs. It also helps prevent devastating situations like the one that took Jesse Grubbs' life by helping to ensure that healthcare providers can offer medically appropriated care for those in recovery. We need to protect people's privacy. The regulations were put into place in the 1970s at a time when we did not adequately protect people's medical records. They were necessary then. But in the 1990s, we passed HIPAA. And while it isn't perfect, it successfully protects the privacy of millions of Americans' medical records every day. We simply should not treat substance use disorder treatment records differently than every other single type of medical record. It doesn't make any sense, and it harms patients. The House passed their companion to the Legacy Act with a strong bipartisan vote of 357 to 57 because they recognize that this is very critical for stopping the opioid epidemic. The Legacy Act makes common sense changes that will save lives and have strong bipartisan support. I urge my colleagues to join me in fighting to include these changes in any final opioid package. I thank the good senator from Tennessee. We have to stop this epidemic in Tennessee and in West Virginia. People in our states are dying. Families and communities are being torn apart. So I look forward to supporting this bill today, but we'll never stop fighting for the people of my great state of West Virginia. Thank you, Mr. President.
Mr. President.